Katie, are you ready to go?
I am.
Okay, got a minute left. Okay, it's 6:30. I'll call to order the meeting of the Oregon School District Board of Education. Today is Monday, November 9th, 2020, and we're meeting via Google Hangouts and conference calls. Could you call the roll, please, Ms. Heitz?
Ms. Garrison? Mr. Mehring?
Here.
Ms. Flanagan?
Here.
Mr. Pankratz?
Here.
Ms. Bijak?
Sorry, mute. Here.
Mr. LeBrun?
Here.
Mr. Zach?
Present. Board has a quorum. I have seen the proof that the meeting has been appropriately noticed under Wisconsin open meetings law. That will be with Katie Heitz at the district office, if anyone wants to expect it. The agenda tonight is our regular AB action for public hearing and action item. We're going to have a public hearing tonight on a request for 2 DPI, Wisconsin Department of to waive statutory requirements for evaluation of certified persons at the end of the first and third year. What we're going to do is I'm going to convene that public hearing, and then the comments, which is number 1 under C1, we'll have in the body of the public hearing. And then after the public hearing, we'll consider the resolution seeking the waiver. And then we have the committee reports and then a number of informational items. So that is the agenda that's posted, and I need a motion to approve the agenda as it has been posted.
It's Krista. I'll move approval.
Is there a second?
This is Tim. I'll second.
Okay, we have a motion and a second. Any discussion? Seeing none, call the roll, Katie.
Ms. Garrison?
Yes. Hold on. Yes.
Ms. Flanagan?
Yes.
Mr. LeBrun?
Yes.
Mr. Mehring?
Yes.
Mr. Pankratz?
Yes.
Ms. Bijak?
Yes.
Mr. Zach?
Yes. We have an approved agenda. Under that agenda, consent calendar is the first item. Are there any items that are listed under the consent calendar that any board member wishes removed for further discussion? Seeing none, I'd entertain a motion to approve the items on the consent calendar.
This is Troy. I'll make that motion.
Is there a second?
This is Anna. I'll second.
On with a second, I'll note that we have 2 donations, one from Oregon Daycare in the amount of $3,000, and then one from After School Clubs, $10,000, both directed toward the Netherwood Knoll Elementary Playground. So thank you very much for those generous donations. Could you call the roll on the motion?
Mr. Pankratz?
Yes.
Ms. Bijak?
Yes.
Ms. Garrison?
Yes.
Mr. Mehring?
Yes.
Ms. Flanagan?
Yes.
Mr. LeBrun?
Yes.
Mr. Zach?
Yes, items on the consent calendar are carried by unanimous vote. Going to agenda B1, comments received from the public regarding the agenda. I checked in with Katie shortly before the meeting and indicated that you had received none. Is that correct?
That is correct.
Okay, so we will not have any of those to read pursuant to our normal protocol. Number 2, OEA report, and I understand Laura Stoller, the president of the OEA, wishes to address us tonight. Laura, the floor is yours.
Thank you. We've been having a lot of conversations with our teachers, both in buildings, but also district-wide. And so just kind of wanted to take the opportunity to share some feedback that we've been hearing. And first, we want to just thank both the school board and the administration for continuing to partner with us throughout this unusual year. We recognize the fact that we have a seat at the table and that our opinions and our voices matter, and we are grateful for that. We really very much appreciate the ongoing collaboration. I hope it's no surprise that all of our teachers, their primary goal is to, be committed to a wonderful education for our students, no matter the delivery model. Teachers at all of the buildings have really been focusing on building class communities, engaging students, and making sure that they're delivering a high quality education as best they can during these unusual circumstances. The majority of our staff in grades 3 through 12 are pretty content with how things are going from the standpoint of the guidance from public health. And I think that's because it's very measured and thoughtful in offering benchmarks about how we might open up for more in-person instruction. So our teachers in grades 3 through 12 have some consistency, and they know what each day is going to bring, right? It's really every day they can plan for and they can focus on building those relationships and having solid experiences with their students instead of worrying about whether or not they're going to be in person tomorrow or not. So that consistency and the knowing what the immediate future holds has been really important for those teachers in grades 3 through 12. Our teachers who are with our youngest learners and with students with special needs have a really different experience, and that's because it lacks the predictability and the consistency that they and their students really need. Many of them have a lot of anxiety about being in person, and they're very aware of the risk for themselves and for their students. So we just would really like to continue to work to provide a predictable and consistent environment for all of our teachers, including our K-2 staff. We recognize that there are no easy solutions in this, but we are going to continue to work and develop the safe and productive caring environments that we know all of our students and teachers deserve. So thank you. Appreciate you being allowed to share some of those thoughts.
Steve, you're on mute right now.
Yeah, I forgot. Sorry. Andrew, student report. I saw you a little earlier. You're up. There you are. Hi.
Yes, I'm not sure if Chloe's on. She said she was having some internet problems.
There she is. She's there. Hi, Chloe.
I'll actually let her start if that's all right.
Yeah, go ahead, Chloe.
Hello. Yeah, I'm having some internet issues. So
You're
Okay.
fine right now.
this week we kicked off the Monday homecoming week. The student council had organized some dress-up days and a few different virtual activities like a online contest and a dance video submission. So we're really excited to see if that can generate some community involvement and kind of get everybody still involved for the fun of homecoming week from the safety of their homes. So we're really excited about a lot of those little competitions that we've got going on.
Anything
Chloe,
else?
great job on the Facebook video.
Yeah,
Nice work.
Thank you.
that was good. Great. Andrew.
Well, I don't really have much to say this week, except I'm just hearing more and more students are choosing to leave our district. I know there was a very prominent student who just last week decided to move to Michigan overnight, pretty much, just to get an opportunity to learn in person because that's what he decided he needed to do. But I think that it's really something that's starting to ramp up. I know today I heard of a third grader who decided to leave the district, go to Evansville. And I think that's a little disheartening, especially because our initial plan was that third grade students would be in person. And right up before the PHMDC order, that student was planning on going to in-person classes. They were meeting with their teachers. And then next thing we knew, PHMDC's order came out and they were forced online. So it's sad to see them go. And I think it's just something that we need to focus on as a board and really look at the effects on the students and see how many students are leaving the district, because I think that's definitely a factor that we need to look at as well.
Thank you, Andrew. And that's information we look at on a regular basis. So thanks. That completes information items. B3, that takes us to action item C, and I will now convene a public hearing pursuant to Wisconsin Statute 11838(1)B regarding submission of a request to the Wisconsin Department of Public Instruction to waive the requirement in Wisconsin Statute 121.02(1)Q relating to the evaluation and writing the performance of all certified personnel at the end of their first year and at least every third year thereafter for the 2020-21 school year due to the ongoing COVID-19 public health emergency. I'm first going to the process will be, I'm going to have I think, Gina, is it you or Leslie going to just talk briefly about what this is?
I think I will plan on speaking about that, and
Okay.
Gina can definitely come in when she wants to add something.
Terrific. And so I'm probably going to have you do that first, and then if there's any member who's joined us via Google Meet, if they want to provide comments with respect to the waiver that we're requesting DPI, to go to the chat function and say that you're interested and identify yourself. And then Katie, you'll let me know if there's anyone in the chat room after Dr. Bergstrom is done with her short presentation on what the request is. Okay. So Dr. Tim?
Just a quick question. So if we have questions about this specific issue, do we run it through the chat, or do we have a Q&A for the board?
You will have an opportunity. There's after we convene or end the public hearing on this, then that becomes an action item for the board, at which time we'll have our normal protocol of asking board questions and commenting at that time.
Very
Okay.
good. Thanks, Steve.
Makes sense? Okay, good. All right. Dr. Bergstrom, then the floor is yours.
Thank you. I just want to walk you through the document that's in your packet related to item C3, the DPI waiver. At this point in time, we are only requesting a waiver related to educator effectiveness. And I will now go through and walk you through why we would like to do that. So as noted in the document that you have, the evaluation, we use the educator effectiveness system, but it is required through statute that our educators are evaluated at the end of their first year and every 3 years thereafter, either using educator effectiveness or another approved method. And within educator effectiveness, there are 6 particular requirements, and you see those 6 requirements listed. We are only, while we must ask for an educator effectiveness waiver overall, we are really only seeking to waive requirement number 4, annual student or school learning objective and professional practice goals. If you grant the waiver, or if you approve our request for a waiver to DPI, we plan to implement every other part of the educator effectiveness. I'm not sharing any type of presentation at the moment. I'm only speaking to answer the chat question. We are only seeking we have to waive the whole thing, but we will be implementing every part of it other than number 4. Because we do believe that even though we are in unusual circumstances, we should continue with our evaluation system, modified given our current circumstances. But what we would like to do is eliminate the school learning objective and professional practice goal. However, as grade level teams and subject area committees, our educators are already working on goals. There is the goal for students to meet proficiency in the grade level standards identified as essential. In addition, the professional practice goal is to increase their capacity to teach effectively in multiple environments. So our teachers are engaging in every part of the process. What we're hoping to do with this waiver, honestly, is to eliminate the need for them to fill out the additional paperwork that is a part of the SLO and the PPG. I think one of the best things we can do for our educators at this moment is identify opportunities to give them the gift of time. Not having them fill out the paperwork, but still having them engage in the thoughtful process is our way of allowing them time. So we don't see this waiver whatsoever as influencing our evaluation process or lowering the bar in any way for any of us as professionals. As we are moving through the process as designed, we simply want to do away with that extra bit of paperwork for this school year. And the only path forward to do that and still comply with statute is to ask you for a waiver for educator effectiveness. So is there anything I missed, Gina?
No, that was a great summary.
All right. Katie, is there anything in the chat?
There is not.
Okay. We'll give it a second. This would be the time if anybody has any public comment about the recommendation to request a waiver on the SLO component. Please put that in the chat. Anything, Katie?
Nope.
Okay, with that, I'm going to close the public hearing and we'll move to agenda item C13 or C3, which is consideration of an action on the resolution on request for DPI waiver due to the COVID-19 public health emergency. So, Dr. Bergstrom, that would be the request to approve or to make the request of DPI for the waiver and to approve the resolution that accompanies the board materials. Is that correct?
That is correct.
All right, so we'll go through and the board and see if they have any questions about this. And Tim, I'll start with you.
The only question I had was one of the items was with regards to our first year teachers. And so I just want to make sure I understand. This is just a 1-year waiver. Our first year teachers are still getting the feedback that they need at the end of their first year. Is that correct?
Absolutely. Everyone who is on a summary year, whether it's a first year teacher or a veteran who happens to be on summary year, will have the entire process focusing in specifically on feedback throughout the year. The only thing that will change is they won't have to do all of the paperwork for their SLO and PPG.
Okay, that's really the only question I had. So thank you, Dr. Bergstrom.
Great. Anna, anything?
No, I think this makes a lot of sense. I'm glad that the administration has recognized the value of time for our staff and have set, in my opinion, very reasonable goals and plan for that item number 4 district-wide. So I think this makes sense and I would support this resolution.
Heather, anything from you?
I'm good. Thanks, Steve.
Okay, Kevin?
Dr. Bergstrom, just so I understand the summary year, if I read it correctly, so the initial year, the first year, and then the third year, every 3 years would be a summary year. Is that what you mean by summary year, or did I misread that?
That is correct.
Okay. So if a first teacher, they're still getting the feedback, a first year teacher, would it make sense for them? And is it considered that they would do it maybe in their second year when hope to God we're back in school in a more regular setting? Or
Yeah, absolutely. As a matter of fact, our system is that our educators are do it 2 years in a row. We have a higher standard than set by DPI. So our first year educators will automatically have another summary year next year.
okay, thank you. That's all I had.
Mm-hmm.
Troy?
Dr. Bergstrom, or actually any one of our administrators or teachers, could you maybe speak to the scope and scale of the effort it takes to do the SLO and PPG paperwork side of things?
I think, Laura, if you're willing as a teacher, it might be good for you to give input in this if you're able to do so, but I'm certainly willing to.
Yeah, I'd be happy to. I would say, we are allotted 8 hours as part of our compensation plan. And I would say that's great. It's not enough. It is definitely more than that. It's a lot of it is data collection, data analysis, working with colleagues, and it's the formalized process. I guess I would say that teachers, the point of educator effectiveness is something that teachers do all the time, right? It's about looking at where your students are, evaluating how to make it better, working with colleagues to problem solve, all of those things. The paperwork piece, the formalized piece, is really tedious. And it is probably one of the #1 complaints of teachers. And in fact, often they say, can we just go back to Google Docs? Because then that's easier. Because it's just a lot of clicks, a lot of putting into formal questionnaires, if you will, the things that we've already talked about and the decisions we've already made. So is that helpful?
That's very helpful. Thank you, Laura. I think that's good for the board to hear from an educator on that part of the process. Thank
And
you.
if I can just add, I think to the point, we are not stopping the process itself. We're just stopping the formalized paperwork of it. Teachers do this all the time.
Thank you. That's all.
Anything else, Troy?
Nope, that's all, Steve.
You're good. And then I think Krista, you're last. There you are.
No, I'm good. I'm good. Thank you.
Great. So then the recommendation from the administrative team is to request a waiver from DPI and to authorize the resolution that is in your packet. I would need a motion to approve the request and to authorize the signing of the resolution.
I'll make that motion. This is Heather.
Heather with the motion, is there a second?
This is Anna. I'll second.
Okay, we have a motion, a second to request a waiver from DPI regarding the teacher evaluation component under state law and to authorize the signature of the resolution that accompanies the board packet. Is there any further discussion? Okay, I'm not seeing any. Call the roll, Katie.
Ms. Garrison,
Yes.
Ms. Bijak,
Yeah.
Mr. Maring,
Yes.
Ms. Flanagan,
Yes.
Mr. Pankratz,
Yes.
Mr. LeBrun,
Yes.
Mr. Zach.
Yes, that motion carries 7-0, and we will affix the appropriate resolutions and submit it to DPI. That takes us to discussion items, committee reports, policy. Anna, anything to report?
Yes, the policy committee met last week, Monday, and we discussed 2 new items of business. The first of which was a discussion of the best practices guide for supporting students' gender identity. It was a great meeting. We learned a lot of really important work that our district is doing in that area, and we expect to bring this to the board for your information as a report on an upcoming agenda. We've not determined when that will come, but it was a great meeting and really a lot of great work happening in the district in that area. The second item we did talk about is a little bit more of a normal conversation for our board. We were starting to talk about the 2021-2022 school year calendar. So we did have some discussion on what that process might look like given the situation that we're in. And so it was a good dialogue, and hopefully we'll be taking some steps forward to work towards determining that for next year. Other than that, that's all I have to report.
Thank you, Anna. Troy, anything from visioning this evening?
We have not met since our last meeting. However, there is a doodle poll out there for a meeting we're looking to have. I think it's the first full week in December, and that would be to have our book discussion on CAST. So if you haven't responded to Katie's doodle poll, please respond. That's all.
Okay. Thanks, Troy. Takes up the agenda item E, information items, opening of school update 2021. Dr. Bergstrom.
Thank you. I will begin the presentation. Just one moment. All right, everyone. I'll give you an update as far as where we are right now. So what we will be discussing tonight, of course, is an update on equity and student supports, the status of phased restart. We will be talking about the family survey results, and then action steps related to next steps for surveys, winter sports, the medical review committee, and preparations for semester 2. So as we've said all along, our goal is to have our students back when it is the right time with the plans that we have put into action. So for support services, what you see in the orange column is what is currently underway. I discussed that quite a bit last time, so I certainly don't want to go over every piece of it again, but I think instead I should emphasize what's happening or what's being implemented right now. So we have our routine kindergarten through grade 4 well checks, and sometimes that is, well, not sometimes, it is regularly happening through the classroom. But in addition to that, student services have plans for other types of checks that includes input from our parents, because we know how much our parents need to communicate to us regarding how their young ones are doing, as well as our older students, but I'll talk more about that in a moment. We are also beginning our support hubs for grades 3 and 4, which is exciting. And that is underway in at least one school and will be soon in the rest. We are also sending out a student experience survey and a well check, as there are some social, emotional, and mental health wellness questions in the survey also. And that will be going out to students in grades 5 through 12. We think it's really important to have our student voice in their current experience, as well as how they're feeling and what they may be needing more of from the school district. And we also have an organization at the school district that is called, well, it's at the high school, and it's called the OHS Hope Squad. It's a group of students who are identified by their peers to receive training on how to listen to their peers when they are struggling, particularly when they're struggling with self-harm thoughts, and then how to refer them to the professionals that can help them. And so there is an advisory lesson coming up at the high school, which will help our students become aware of this resource that is there for them, in addition to all of the adult support. I will move on now to reopening metrics. It's sad to say that the last time we were together, the 14-day average was, I believe, might have been either, I think it was 177. And then last week it was 214, or 2 weeks ago it was 214. And now this last week it's at 277. So the number of cases in Dane County, unfortunately, continues to climb. And at every metric that has been established by organizations such as the CDC or Harvard or Minnesota, and all of those metrics right now, we should probably be virtual in all grades, or hybrid in elementary. So it's unfortunate that the numbers continue to climb, but what I want to do is talk a little bit more about what it is that we can actually do, in addition to giving you some information on what that looks like locally. For example, every week, Public Health is putting out a community transmission report where they have the average number of cases per 10,000 people during the latest time period. For the last 2 weeks, unfortunately, our community of Brooklyn has been number 2 in Dane County for the number of cases per 10,000. So it's proportional to its population. And that is not including the part of the Brooklyn community that's actually in Greene County. So you can see that the village of Oregon and the town of Oregon, et cetera, are not in the top 9 for communities in the county. Unfortunately, for the last couple of weeks, Brooklyn has been. And I hope that is an anomaly and that changes soon. If you just want to, I just want to make sure everyone can read the graph well, and it's coming straight from Public Health. So the red line is the Dane County rate of 71 cases per 10,000 people. So you can see that many of the communities in the county are well over the average. And that speaks once again to the fact that the majority of cases are now outside of Madison. I believe at the last count it was 56% of cases are outside of Madison. So when you look at numbers like that, of course you would ask yourself, then why in the world is K2 still here? Well, still here meaning in person. Believe me, we check on this frequently, weekly, and I think the response from Public Health indicates very good news for phasing in other grades, because the response is continually that the transmission isn't seen in the school. Now, schools are reflecting the transmission that's in the community, and I'll show you a slide on that in just a moment. But right now with K2 open in several districts, they are not seeing the transmission coming from that environment. And I think that's very encouraging when we think about extending in-person instruction to other grades. But you can definitely see how what's happening in the community is being reflected in our schools, even though right now we only have 4K through grade 2 in person. So as of Friday, November 6th at 2 p.m., you can see what our cases look like. And if we look in total, I think since September 1st, we've had about 70 staff members quarantined, and that would include positive cases. And I believe we've had a total of 13 students who've tested positive overall. And remember, we only have the data on those that are attending in-school classes or in-person classes, because people are not, while we request it, people are not required to notify us if they are not in in-person schooling. So this, of course, all feeds into how does it impact our plan? Well, right now you can see we're to the point where we have support hubs. It says grades 5 through 12, but in reality it's grades 3 through 12 at the moment. So we are bringing in students by invitation, the students, and we discussed before how they might be prioritized, such as internet connection, lack of engagement in their schoolwork, social emotional support. So all of those things are happening at all of our sites. And as we know, the next step is grades 3 through 5, followed shortly after by grade 6. As we know that grade 6 in our community is in the elementary school or in the intermediate school. Consequently, we would be bringing them in close to the time we bring in 5, 6. One of the things that I've heard quite a bit about from public health in our frequent updates is the fact that they are continuing to re-examine and to update their plans, their guidelines, their metrics. As a matter of fact, there could be updated guidelines in the next month or so. They're paying close attention to emerging science related to transmission and everything else that you see up here right now. And so knowing that, I'm sure many of you are saying, well, what is the holding pattern? Why are we waiting? Well, a significant part of why we are waiting is what's happening in Wisconsin and in Dane County. And I think that we would be much more likely to have a change in metrics from public health after we have reached some sort of period of stabilization. But the trajectory is, anyway, if you read the news, the trajectory is significant. However, even with that, there is emerging science related to transmission, and public health does plan to continue to update guidelines, including guidelines for school. So that is an exciting update, and they certainly didn't tell us what to expect, other than to understand that whatever they put forward will be based in the science, and that we are learning more all the time. What we can do right now is proactively prepare, and we are, because another one of the pieces of information that has come from public health, in addition to consultations with districts that have had the in-person experience significantly more than we have thus far, is that it will require additional staffing. And consequently, we are taking the steps right now for recruiting and hiring substitutes and paraprofessionals, so that when staff members are ill and or quarantined, we have class coverage. Now, thankfully, when our staff members are quarantined, many of them are able to continue teaching from home, and we need an adult in the classroom for supervision, and the teacher is on the screen. So we're being as creative as possible with the utilization of the adults in our buildings already, and we plan to have more adults on staff to help us with that as we phase in more grades. We also know from working with public health and consulting with other districts that we will need to conduct additional contact tracing, because as I said, schools are reflective of what's happening in the community. And we also know that public health of Madison-Dane County, in addition to public health departments in many of the surrounding counties are now in emergency mode related to contact tracing, which means that they will, of course, do more if they can, but what they must do is they will contact the person who is positive, and that person may need to be the one who contacts those who are considered to be close contacts in their life. When really, when you look at that, what it means is that the schools have considerably more contact tracing to do themselves, and that it's critical that it's done in a timely fashion, because informing people that they are close contacts, that can't wait a few days. That has to happen immediately so that we can keep the environment safe. Consequently, we strongly believe we will need to add some people to assist with that process. As you know, Gina Jonan, our HR director, works with the staff part of contact tracing, and our nurses currently work with student contact tracing. And everyone's done a fabulous job, but as we bring in more grades, we will also have to have additional staffing of the isolation room that is required at every school. So our nurses will begin to be spread thin, and we need people available to do contact tracing in a timely manner. Consequently, we are exploring and securing additional personnel and resources, because that's an important part of what will be necessary as we open up more grade levels. We also know that we're getting to the point in the next few weeks, certainly in the next month, where we need to ask our families about their preference for semester 2. Because if you remember back to August, we asked our families to commit to Oregon Online for a semester. So now we need to know if there are families who would like to move back to phased restart, or if there are phased restart families that want to move to Oregon Online. We need to have accurate numbers in order to be able to do the cohort groupings that are necessary for the plans that will be in place for all grade levels, in addition to who needs transportation. So while all of that is figured out for 4K through grade 6, we also now need to know grades 7 through 12, as well as who might be changing from the preference that they expressed back in August. Then another action step is certainly related to what's happening with winter sports and how we are working through providing opportunities to our students related to athletics. So as many of you know, practices start for our winter sports next week, the week of October 16th and November 23rd. So over the next 2 weeks, we'll be seeing practices beginning for winter sports. We also heard, and we completely agree, that there are a lot of students who need to be engaging in healthy activities, but perhaps they're not someone who is engaged in winter athletics. Consequently, we are working with community education to develop some opportunities for students to engage in healthy physical activities, both outdoors and indoors, according to the public health requirements, because I'm sure, as many of you are aware, gym use, or most things that happen within a gym, are highly regulated under Emergency Order Number 9. They are not recommendations, they are not guidelines, they are requirements. So anything that we plan for our students and any of our athletics have to align with that. And then, of course, we are practicing and preparing for the competition that we are very hopeful will be able to happen for our winter athletes. And finally, we have put together a student leadership group of athletes, representatives from all of the sports, because we feel it's really important to keep our students informed and to make sure that they are a part of the process, a part of what's happening around them. So the student leadership group will meet with our athletic director, Mr. Carr, and our high school principal, Mr. Pleiner, to be informed on what is currently happening and what changes are upcoming, and certainly what they can hope for in the future. We will be communicating more to our families and to our students in the next week about what is possible, because we know how important this is to them, what a huge role it plays in their life, and how important it is as we enter into the winter months that we are providing opportunities for students to be physically active, both in athletics and in other ways. And that's where we brought in our treasured partner, community education. And we hope to expand it. They'll just be a great place to start because they are such an organized group that has a pulse on what is helpful and needed in our community. Now I'll move into the parent survey results. So as we mentioned, I think at the last board meeting, well, it wasn't closed at that time. We had just given you an update on the number of responses. When it closed with 2,530 responses. And that means that it's fewer families than that because it's a response per child. So if you are a parent with 3 children, you are filling out the survey 3 times. And it ended up being approximately 63% of the students are represented through responses in the survey. And 4K, they conducted a separate survey and they had a 67% response rate with 143 responses. So we asked our parents or our caregivers to please describe or to please select their opinion related to the current online experience when compared to last spring. Because while we as educators believe we have improved the experience dramatically, if our families and our students don't feel that, then it really doesn't matter what we believe we've done. So we really wanted to do a temperature check and make sure that our families could feel that. And overall, 85% of our respondents felt that the online experience is either better or somewhat better than the spring. As far as classroom logistics, and remember this was a survey that the students or the caregivers in grades K through 12 answered. So you can see the answers here, and we know we have some room for improvement, and we will be working on that via our action items. So thankfully, as far as the number of students who have trouble accessing the online classroom and the number of students who don't know who to contact for classwork, the numbers are small enough where we'll be able to do individual outreach. Related to who to contact when they need additional assistance with technology, we'll be doing more to message on where to go for that kind of help in the weekly updates that I am sending out, as well as the school and the teacher newsletters. As far as relationships, we have set that as a priority during our period of online learning. And so it was important that we ask a question related to family perception and whether or not the student had a relationship with at least one teacher from the school, because we know the role adult relationships play in providing that foundation that is essential for a high level or high quality education. So we had a 91% yes and a 9% no on there. And consequently, you know, it's great to celebrate the 91% yes, but our thoughts and actions go directly to the 9% of no. So we're conducting individual contacts with students and families. And in addition, we are sending out the student survey this week. And I'll talk a little bit more about that later. But I think it's really critical that we hear from the students on this issue too, and have a really good understanding regarding their perception. One of the things I've learned throughout many times, and we've spoken about many times in my career, where I have spoken about relationships and connections, is that oftentimes as adults, we see the connection and we feel the connection, but that doesn't necessarily mean that the students do. So it's always critical to ask them. And I also know that it goes the opposite way. Sometimes students feel very connected even though they're quiet, and you might not know that they feel that sense of connection. And that's why it's just so important to ask and to take seriously the responses you get and to create plans based on them. So now to look at our responses related to learning. So as far as synchronous learning and whether or not people felt we had too little, just right, or too much, you can see the results there, as well as how respondents felt about recorded or independent learning. So what's really important with this set of information, in addition to information that I've said previously, and especially the question at the bottom of the page, my student is challenged academically, because a 20% no in that particular statement is a really important red flag for us. So as far as how we move forward, well, we're doing deep dives by grade level and by school so that we can have a better understanding. Are there pockets where there are more people than average who feel that it's too much or too little in any of these pieces, or where they feel their student isn't being challenged? So if we can narrow it down and get a better understanding of where we need to focus in our efforts, that's a really important piece. And then the first step in that is to look at the universal experience. What are all students experiencing, and how can we improve it? How can we add rigor for all? Because an opportunity for every child to experience rigor in their lessons is extraordinarily important. And then the next step would be, after we looked at the universal experience, how do we bring enrichment into the classroom to provide that additional level for students who still need more after we've provided it in the universal? And we really do believe, once again, in enrichment for all. Advanced learners have a very specific set of needs, and we work hard to meet them, but they certainly aren't the only group that requires enrichment. All of our students do. With any student around a topic about which they are interested, you will see that they will go further, they will dig deeper, and they will do more when it's a topic that really, lights them up. So the next part of the survey went to our in-person experience for students in grades K through 2. And you can see the results of the respondents in front of you. So you'll note that there is a lot of opportunity for individual follow-up when the no's in the first 2 questions are so small. So that's really important. And it's also important for people to know that every response is being read. Every open-ended response, all 3 of them, are being read thoroughly. And we're looking for ways to be able to improve not just big picture, but to improve that student's experience. And when it comes down to people and their comfort level related to safety procedures, we know oftentimes that will result in some phone calls being made and some continued communication about what the procedures are. We're also consistently reviewing our rules for mask breaks. As you can see, there's a large portion of our families who feel comfortable, and there is a considerable slice of our families who don't. So we're working to continually review what is appropriate and when it's appropriate to give a mask break, especially considering we have them for such a short amount of time. So what's working well? Well, that was one of the open-ended responses that we gave. And I think it was, 25,000 characters was what was allowed in the open-ended response. So people could write, I checked it out, I Googled it, it's up to 7 single-space pages that people could write if they wanted to, because it's important that people are able to tell us about their experience, the positive, the negative, and anything else that they want to say. And once again, I want to emphasize that not only are they being read at the district level, but they're also being read at the building level. What people tell us matters, and we're using it to improve every part of the experience. And I'm thankful to say, and not at all surprised, that teachers were the #1 theme that came out of what is working well. So we know that our educators have truly risen to the remarkable challenge, and they love and care for our kids very much, and they're working hard, and that was recognized throughout their open-ended responses. The themes came out for real-time interaction. That was working well for many of the families, as was consistency with platforms and technology. Because if you remember from last spring, too many different platforms, too many different passwords, all of that was a challenge. And so we have narrowed it down to specific platforms. We also have worked to have single sign-on procedures so that if an app is an approved app, you're able to sign on with your Oregon School District credentials. Another theme is that a lot of people appreciated the flexibility that their students have and the independence that they're developing. And interestingly, there were several people who commented on students in the upper grades getting more sleep with this schedule, which is interesting. They also put down as a theme, or we pulled out as a theme based on the responses, the clear schedules and the expectations. And there were quite a few mentions of the appreciation of the OHS block schedule design. Now, as far as what are our opportunities to improve? Well, interestingly, oftentimes the positives and the negatives are mirroring one another. Because while a lot of people spoke about how much they appreciate the time the teachers are spending individually with the students, or in small groups with the students, or just the appreciation of synchronous time, we're also hearing loud and clear that parents are very concerned about wanting more opportunities for their students to interact with their teachers and with one another. So social opportunities is a really big component to what we are seeing. And we're hoping that we're able to meet some of those needs through the clubs and the athletics, but we're also working to make adjustments to how we design the student day to allow more opportunities to meet those needs. Another opportunity for improvement, there were a lot of people who asked for more online synchronous interaction. And I think that really connects well to the additional student support piece. And then finally, a lot of feedback related to logistics and organization, making sure things are clear and consistent. Sometimes it was difficult for people to know whether or not assignments have been submitted and how to track that, and making sure that the feedback is timely, and really making sure that we're offering enough for our students on Wednesdays. Wednesdays came up as a theme. Consequently, we're working on how to make those days more productive. But first, we have to dig in to make sure we understand who answered the survey in that way. Like, are the families of the high school students answering the same way as the elementary? Or is there more concern related to Wednesdays for younger students? That's part of what we are currently involved in. As far as other open-ended themes, because we also had the third open-ended question was, what else would you like to share with us? And so those were a lot of varied responses, and they were really important to read. There were a lot of thank yous to teacher and staff members. There were a lot of comments related to the need for in-person options for students. There were a lot of comments thanking the district for following public health. A lot of people who put down it was a lot better than the spring. A lot about how it's just too much expected of parents. And, you know, that is, there's no argument on that. There is a lot. We're working very hard to create activities where students can be independent, but we know that this is a heavy load for our parents. Either the parents, for everyone, but particularly the people who either have to work outside of the home, or for those who are trying to work in the home and help at the same time. And definitely concerns about student mental health. We hear that loud and clear. We have the same concerns ourselves, and we spend quite a bit of time working through various levels of support related to mental health, because it's not one solution. It's multiple solutions put together to make sure that we are providing as much support in as many areas as possible. And frankly, there were some people who just didn't like the survey. And that came through too. But what I really want to make sure people know is We hear you. We really do. We're reading it all. And we're taking it in and we're refining our plans and we're talking about it. And we're talking not just at the district level, and at the principal level, but at the school leadership team level. What our families think about this experience is important to us. Because while there are some things that are out of our control, there are a lot of things we can control. And therefore, we want to make it the best possible experience it can be. As far as our next steps, this week we're sending out a survey for our students in grades 5 through 12. And there's a presentation to help students understand what the survey is about and why we're asking it. So it's not just a link that we're sending out to them, we're giving them some context. Consequently, there's no one date where the survey will be available to all. It will be presented to students either through their homeroom or their advisory or their connections group over the course of the next week. We also hope to have some student feedback groups, because not only do we want to hear from our students via the survey, but hearing from students in conversation is important too. And I know that our principals are doing that already, but we will establish more opportunities for that to happen. We also have the staff survey ready to send out, and that will go out this week. Now, the next thing, because we're going through several agenda items in one presentation. So I'm wondering, Mr. Zock, would you like me to work through the medical group before we do questions?
Why don't we take a break right now to ask questions on what we've heard through this point and give your voice a little bit of rest. So let's go through Anna, and then Tim, you're next. Any questions or comments? Questions or comments about what you've heard to this point?
Just a quick question. Curious, you mentioned obviously with the going to more in-person students that will want to have additional staff in place to manage that as far as substitute teachers, and you mentioned obviously additional resources for contact tracing. And maybe this is an Andy question, or maybe it's for you, Leslie. Was that part of the money that had been allocated for COVID purposes, or is that something that would be, I guess, how are we paying for that with the budget?
Well, I can start and then Andy can add. So at the very highest level, I would say that we're not calling in as many substitute teachers as we would on a regular basis. So our pre-established substitute teacher budget is definitely a source of funding for that. But also, and from the weekly, you know that our food service is doing much better than expected. Consequently, some of the money that was allocated for COVID resources that we thought was going to food service may not need to go there. And we're able to spend it in other ways to assist us in the phased restart. Andy, is there anything else to add?
I would also say that we're saving some money on cleaning, which we're still cleaning things at a very high level, but our contracted services costs are quite a bit lower so far. That will ramp up a little bit as we begin to have more students in the classroom, but we are saving some money now that could be utilized for that as well.
Great. A lot of information to process, and at this point, I don't have any further questions right now.
Tim, and then Kevin, you're next.
So Dr. Bergstrom, I'm going to step way back to the beginning of your presentation regarding you said that public health is looking at the possibility of making changes or updating metrics or whatever the case may be. Have any changes been made by public health with regards to schools since the beginning of September that I'm unaware of?
No. The metrics that were established at the end of August continue to be the metrics for schools themselves.
Okay, I just wanted to confirm that was the case. With regards to contact tracing, there are lots of parents who have, reached out to us to say, if there's anything at all that I can do to help, please let me know. Is that something that we can involve parents in?
Probably not because of the confidentiality piece. It would have to be an employee of the district making calls of that nature.
Okay, I hadn't thought about that. Thank you. You mentioned that that we're preparing for resources. We've been preparing for resources and having a better understanding of, you know, folks' intention of staying virtual versus going in person when that becomes available. How are we gathering that updated information?
We'll send out a form to help people make that discussion or make that selection. And we'll also have a question and answer session for parent or for families prior to asking them to make that choice, to make sure that they understand what the options are.
And do we have a schedule for when that's happening, or is that something that is just in a holding pattern?
Well, it's a little tricky because we felt that we may have asked the question a little too early in the summer, because then we had to ask it a second time and it became very confusing. So we want to be able to ask it late enough so that people feel they have the information related to what's happening regarding transmission in the state and in the county, but they feel like they can make an informed decision and not have to change their mind in 2 weeks. So, you know, we're trying to find that sweet spot, which we think will probably be about the first or second week of December, because that would give us preparation time for transportation routes, but it would also give them a little bit of time to know, to be able to feel like they're making a very informed decision.
Okay, thank you. One last thing, and again, it's just for clarification for me. The K through second grade students, do we have a choice program in place for them, or everybody's under the same plan for K through 2?
No, we have a virtual option for K2.
Okay.
Yeah.
All right. I couldn't remember if everybody who was K through 2 was required to be face-to-face, or if it was there was a virtual option. That's all I have for now. Thank you, Dr. Bergstrom.
Thanks, Tim. Kevin, and then Heather, you're next.
So Dr. Bergstrom, could you just, maybe I'm just looking for a glimmer of hope, but can you expand a little bit on Dane County's potential for this kind of, maybe I'm again being overly optimistic, but this desire to kind of take a deeper look amidst, you know, the numbers going up in terms of testing that you, and I'm not asking you to conjecture here, but is that related at all to the fact that more and more proof exists that especially younger grades, that transmission's not happening at the younger grades, or do you have any thought on where that's coming from, or is that just your personal kind of take on the discussion?
Well, there's certainly, I'm certainly putting my own interpretation, because we all do that after we listen to people, right? We put it through our own filter. However, what I'm hearing is that K2, we're not seeing transmission within the schools, and that's certainly been our experience, right? We have a lot happening in our community, but it's not necessarily going from teacher to student or student to student within our schools. And that's because of the protocols that are being used. So what I'm hoping is coming from public health is the fact that based on that, are we able to then expand the number of students that we are servicing in person? Particularly at the elementary level, because I think that's the logical next step for public health. And so what I'm hoping is that's a part of the beginning of December update. And considering where we are at the moment, I don't expect that they will at that time say it's the perfect time for expanding. I don't know. But what I think they're going to say is that it's a logical next step, and the metrics don't have to be what they were established to be in August.
Sure. So, you know, there's a lot of news and you can't really stay on top of all of it. I've seen recently that Oconomowoc, I think it was just the high school, went back maybe to all virtual for at least a period of time because they had a little bit of an outbreak. Have you, again, this is just kind of anecdotal, but have you seen any examples of that more at the younger levels? I mean, if we tried to narrow it down to even 5th to 6th grade, up to 5th to 6th grade, I mean, just in general, because I know you're following it very closely. I'm just picking up bits and pieces in the news.
Sure. Do you mean, are there fewer elementary schools that are closing than older grades? Is that what you're asking?
Yes.
Yeah. It seems to be, but here's the very challenging thing, is there isn't an established tracking system for the state of Wisconsin or the country. So there's looking at a lot of different people who are trying to put together their own spreadsheets. For instance, the National Educators Association has a spreadsheet, right? And you can sort it on Wisconsin. But what it is it's links to newspaper articles related to what districts are doing. It's not like a count, you know, or something that would actually be, in my opinion, very useful for us, right? Like if we actually had a statistic that told us only, I'm making this up, so those of you who are listening and you get, you know, it might sound really good, but I'm making it up. If we say there's only 15% of our elementary schools who are in person had to close for any particular piece of time, that is useful information. But there is no collection system for that information currently.
Yeah, I would imagine it would help, obviously, in where you kind of draw the line and apply the science. But is it 5th grade? Is it 6th grade? Is it 8th grade? I don't know, but just a curiosity question. That's all I have. Thank you, Leslie.
Thank you.
Heather, and then Krista.
Yep, thanks for the presentation, Leslie. I had just a couple questions. I noticed in many of your slides that your team, teachers, et cetera, staff are going to be doing individual follow-up. Does that also apply to the, I think it was the 14 or 16% of people who thought maybe that the fall learning was not, you know, either equal to or not as good as the spring learning? Will you be doing follow-up based on the virtual feedback as well?
We'll probably be spending more time looking at the specific questions. You know, the students who don't feel or the families who feel their students aren't being academically challenged, for example. I think that's probably a higher leverage point as far as conversations and personal interactions.
Right. So are you guys comparing those numbers and how they intersect or Venn diagram between that first question and however it breaks out then?
Absolutely.
Okay, great. And then do you think at the next board meeting we would have that additional information broken down by grade level that you were talking about? I'm just curious to see that.
Yes, we could absolutely do that.
Okay.
And we could certainly also put some versions of it in. There's other opportunities. I think I have to share it too, but I'll make sure we share that because I'm sure it's a point of information that's important to all of you.
Yeah, that was my next question, is how will this, obviously I know that we always, you know, the board presentations are available, but will this be shared more specifically and widely through the mailer emails, or how will this be going out to the parents of the district?
That hasn't been completely determined yet, because it would be very easy just to post the graphs, etc. on the website. That's not a problem. But I think that a really important part of the information is what people put in their open-ended comments. And that, of course, is information that we wouldn't normally post because there's also personal information in it.
Sure. And then my last question is unrelated to the survey. So for the winter sports piece, if obviously I'm understanding this, we'll be following the guidelines so that practices can begin, but currently games or competition are not scheduled. Is that correct?
Yes. So what I think is a distinction that I want to make sure I highlight is that related to athletics, they're not guidelines, they are requirements.
Oh,
that are coming straight from the emergency order, and they're giving us very specific parameters around which we can hold any practice. And competitions are currently not allowed under the order in Dane County.
Okay, thank you for clarifying that. And then, so is it your expectation that at the time competitions will be allowed, that will be the time that age group of students would be back in some sort of hybrid in person? Or have they talked about kind of the correlation of sports and academics?
That's a great question. It's hard to imagine that we would have a situation where kids could play basketball but couldn't go to school, right? that doesn't align logically. Excuse me.
Great. Yes, I agree. I just was curious if they, yeah, I'm just curious how they had talked about that. So if that's the case, then that answers my question. Okay.
All done,
That's it for me. Yep. Thanks.
Good, thanks. Krista, then Troy.
Thanks, Leslie. I really appreciate the action steps part of the presentation because I think that gives us a forward movement and lets people know what's next. So I guess my questions are somewhat associated with that.
Mhm.
So the Q&A session that's coming for parents in advance of them making the selections for the next step of phase-in or in person, I guess I'm wondering if that Q&A will also touch on K2 families have gotten exposure as to what in-person means in this environment.
Mhm.
And so at what point, or is that the point that families will really know what does a high school day look like? And I'm not talking about the cohorts, I'm talking about mask wearing or what lunch is going to look like, or can they move between classrooms in the hall? Is that sort of, because I think that's the other important piece is what does school in this environment actually look like?
I think that's an excellent opportunity. I think that will also come up at a board meeting because I'd like to make sure that we have multiple opportunities to make sure families have an understanding of what school will look like for their child.
Okay. Then my next question goes back to, kind of this resource question, and we had allocated $1.5 million for COVID. But as we know, as we get more students back in school, like you said, it's going to ramp up our contact tracing because the whole point is once we get in school, we want to stay in school. We don't want to be in and out, in and out. And so I guess my question is, we need more people for contact tracing, but have we also looked at, or do we have examples of schools, and I know New York City did this, about temperature checks and testing. So do we envision working with UW or doing anything that would really help us be in school and stay in school in terms of temperature checks before high school kids come in the door? Or, I know workplaces have done apps where kids have to check in with a red light, green light, how they're feeling that morning. I guess I'm just thinking ahead if we're looking at doing any of that sort of next step as well, besides after the fact contact tracing.
Of course. Well, one of the things that's important to note is right now public health isn't necessarily recommending temperature checks.
Okay.
So because of that, we haven't implemented it. And I know that in a conversation with a professional a while back, they said it has to be done very carefully or it ends up causing clusters of students together waiting for their temperature to be checked.
Right,
The exact opposite of what you want. So we haven't gone down that road yet. We have investigated apps related to students doing or families doing wellness checks. However, though, I'd have to say with our K2 families have done an absolutely amazing job of monitoring their child's symptoms without it. The reason that we have been able to stay open and do so successfully is due in large part due to our family's commitment to keeping their children home when they are exhibiting any symptoms. So that's a huge thank you to our families. And as far as testing goes, I'm glad you brought that up because what has been said in many circumstances when I'm with professionals who have an in-depth knowledge about this, and that is that when schools were able to stay open for a long period of time, it often has something to do with the fact that they can conduct testing. And right now, there is no plan in the state of Wisconsin for schools to be able to do testing. We've asked public health, and they said that there is nothing in the entire state that in any organized way that will allow that to happen. However, as a school district, we do have a wonderful partner, and that is the Orchard Study. And it is through the Orchard Study that when you test, we do the swab for flu, they're also testing for SARS-CoV-2. So that is a huge plus for our community. Now it's not, it takes more time perhaps than if you went to the Alliance Center or something of that nature, but it does allow us access to testing that other communities do not have.
And I think that is a huge key, and that's something that we could really lead in as a school district with this relationship with Orchards, is that, again, when we get more students in, we can keep them in and we can keep our teachers in if we really take advantage of those relationships. Or, you know, it just came out that the UW system is also putting more money into advanced testing, and there may be a partnership there. But, you know, those are things that I think are really exciting for us, that it's the long-term game of once we get in, let's stay in.
100%. And I also have to acknowledge the fact that it's also connected to the capacity of the Orchard study.
Yeah.
Right. So they have a certain number of people who are working for them too. And so I don't think their intention is to necessarily be a COVID testing scenario. They're a flu study, but we're just fortunate that at this time it also senses the other virus.
Great. Yeah, I'm glad you also pointed out, I saw the national study on that too, that one of the benefits of COVID for older kids is that they are getting more sleep, which really helps with mental health and with stress. And so I think that's a really important point that is happening in our community too. As far as the survey, I think it's really great information, and I'm really looking forward to seeing once the students do the survey and what are the correlations with their parents. If we see some similarities, and I know you and I have talked that we can kind of deep dive and correlate by student ID, the parent with the student, to see if there's if they're viewing things the same way, or if there's differences on each side. So I think that's going to be really interesting for us. I guess my last point is what you talked about with Dane County Public Health really looking at re-examining their metrics. That's pretty hard to do when you go from 177 to 214 to 277 as a 14-day. You know, and it's not only the positives, but the extent of community spread, and then it's the contact tracing that, you know, I have a friend that's a full-time contact tracer, and her job used to be letting people know that they've been exposed to COVID, and now she's talking with people and letting them know that they have COVID, and that there are counties that have given up kind of contact tracing because they're so busy. And so the school district, we have a big responsibility in terms of educating our kids, but our community has a big responsibility too now. And as we're at 277, and as we go into the holidays, I think that really impacts our ability to bring kids back. And so I just, you know, I know we take on a lot of responsibility as a school district, but our community has a responsibility here too. We've got to get these numbers down. Thank you for all you do.
Thank you.
Troy.
Just one comment and one question. Leslie, one of your action items was talking about student feedback groups. And I think that's a great way to get some feedback and some ideas for improvement. You know, our kids are living it, and so they're the best avenue that we have to improve this experience. I know that my perception as a parent is much different than my kids, and you know, we're living in the same house and I'm watching them through virtual learning, but their perception is just so much different than what mine is. So I'm really happy to see that is on your action item list. I know earlier on in the school year when we did the advisory sessions at the high school that were focused on improvement ideas. I had an opportunity to view one of those, and there were all these great ideas that the students were providing in that environment that was facilitated in a constructive manner, and things weren't focused on, people weren't focused on the negative things. They were focused on what little changes can be made to improve this overall experience. So I just wanted to accentuate that that's a great avenue to get some great ideas for improvement. And then I guess my question is on a different topic, but when you were speaking about as our educators have to quarantine, and if they're a licensed educator that's teaching virtually and they need someone to provide that supervision in the classroom, you mentioned hiring paraprofessionals. Have we thought about utilizing volunteers to perform that role, or and I'm assuming there's a lot of variables with that. It wouldn't be a consistent position, perhaps, and licensing and things like that. But anyway, my question is, has that been discussed? Is there an opportunity for volunteers to provide that classroom supervision role?
I think we have some really amazing volunteers in our community. And we've seen that through the remarkable PTO organizations and organizations like Friends of Oregon School District. So yes, there are definitely people who could do that. Now, of course, and could do it well, I'm sure. Our first preference is always someone that we have hired and that we put through a series of trainings because it's not, you know, supervising children, no matter the grade level, is something that takes a little bit of practice. So if we can have people who've been through a training program, I think that's the very best. Now, could we provide a training program for volunteers? Yes, I think once we have more students in the doors, I think that there will be a lot of families who will be willing to do a lot to make sure we keep it that way. But our first preference is always someone that we've hired and trained, if at all possible.
Okay, thank you. And that's all I had.
Thank you. Board members will have a chance to circle back. We just wanted to take a break during this part of the presentation and ask questions up to this point. I don't have any questions, Leslie, other than one comment was, and I was going to say this to the end, but it seemed appropriate now. I had the opportunity to watch online the virtual presentation of Clue that the Oregon high school students put on, and it was phenomenal. Mike Doucette was the director. He's done the musical every year for the district for a long time, and Nate Mendel was our PAC guy who did all the tech work. And Mike Doucette came on at the very beginning of the play and said that their goal educationally wasn't to focus on or to worry about what the students were missing by not performing live or having that opportunity to do a musical, that their focus educationally was, what can we learn about acting through this experience and how can we make this better? And that, I just thought that was tremendous. And then when you watched what they did on screen and virtually and how they performed without an audience was terrific. And I liked this presentation. We all know that there's a debate about when we're going to bring kids back. But I thought this was really good from the standpoint on focusing on, we're here doing what we're doing right now. Let's make it better and focus on that educationally. And I saw really a lot of good things along that line. So thank you. And I guess it's back to you to keep going with your slide presentation.
All right, we only have a few more to go. So now we'll talk about the medical working group. And it's actually really exciting because not only do we have an established purpose for the group, which you can read here, but we also, as of today, had 38 potential volunteers and amazingly high qualified people that we would all be thrilled to work with. So it's exciting. And the volunteer form is open, I think, through the 15th. So there will potentially be even more wonderful people for us to work with in the future. And I'm excited about that. So you can see here what we've established as the goals for the group. And on the next slide, you can see what we will be asking of the people who are interested. We're looking for members to do this for about 3 hours a month with us. So it would probably be, but we would certainly be flexible with our volunteers, probably be the Monday opposite the board meeting. And we're asking them to complete the interest form. We'll go through all of the volunteer forms by November 23rd. And we hope to begin meeting by the last week of November. And you can see we're seeking members in a variety of fields. We prefer licensed and currently practicing volunteers if possible. And we're also looking for a representation of the Oregon student body. So we're looking for a lot of really wonderful people to come together and be partners in helping us understand all of the complexities that are a part of our current situation and the accompanying decision-making process. After that, I wanted to just give you a brief update on our equity efforts, because I want this to be sort of a standing part of our report to you, because it's such an important piece of who we are as a district, what we're trying to accomplish for our students. So, and we do so much that I want to make sure that it's on your radar continuously, as well as the people who are watching the presentation. So we had a learning session with Nehemiah on October 29th, and we collected feedback from our teachers. It was a 1-hour presentation followed by small group discussions facilitated by our staff members who had been trained by Nehemiah. Extremely positive feedback on the presentation and the impact it had on people and their thinking and their planning. We're working with Nehemiah to sponsor another community forum, a virtual forum, to be held on December 1st. And you will start to see information on that forum come out to you, either through my weekly updates or through social media posts, etc. It will also be on our website. And we're pushing forward in a very strong way with the anti-hate speech policy implementation. So this week, our school groups of teachers are preparing lessons to help students understand the why behind the policy. Then they're bringing them back to the task force to review the scope and sequence so that we can look at how it's laying out from our youngest learners to our oldest learners. And then for our families, because it's really important that we're continuing to update our families on what's happening, you will be getting updates either through my weekly emails, newsletters from the principal, and then the scope and sequence of the lessons themselves will be posted on our website for people to take a look at. And as mentioned by Anna previously, related to our transgender support document, that's another important equity-related effort. Our student services staff members received a training from the Welcoming Schools organization, and that we are very far along in putting together our guidance for supporting our transgender students. And they are practices that we have been doing for a long time, but we wanted to make sure that they were clear, accessible, and recorded. So that is why we're putting it together in one document, and we will bring it forward to the board as soon as it's ready so that everyone on the board is well informed also. And I believe that gets me to the end of the update.
So we'll circle back the other way then, see if there are any final comments or questions from any board member. Troy?
Nothing further.
Krista?
No.
Heather?
Yeah, the only thing that I would say, Leslie, is I would love to see more communication around for the community regarding our work on the hate speech. I think the standing equity agenda item is really important, but unfortunately, I'm guessing this school board meeting doesn't reach the majority of the district and the community. So whatever we can do to continue to push that messaging out would be great.
Thank you.
Thanks.
Kevin?
I'm good.
Tim?
I'm good.
Anna?
One quick question. Can you remind me what the size of that medical working group was going to be? Is there a range of the number of people that's going to be on that medical team? I'm just curious. I can't remember.
I believe we were hoping for about 10.
Okay.
However, you know, when you have a good group, sometimes a little bit bigger is okay.
Right. Not that you've got a set number, but I was curious to know approximately. So that's really all I wanted to understand. Thank you.
Mm-hmm.
Tim? Wait, I got Tim already. Yeah.
Yes.
I don't have anything. I lost track on my scorecard. Good. Thanks, everyone. Thanks, Dr. Bergstrom, for the presentation and the update. That'll be, every meeting we'll have that on as an agenda item to walk through. And Leslie, I think we're all the way through E for the equity update. We've taken care of all those agenda items.
Yes.
Okay, so that's attendance at the WASB conference, and That was going to be January 20th through the 22nd over in Milwaukee. It was going to be celebrating WASB's 100th anniversary, and they pulled the plug on in person, and they're doing a virtual session. You guys should, in your board members, the school news, I got to get that up closer. There's items in there, kind of a breakdown of all the sessions. So if you want to register for that and attend virtually, check with Katie on that. We will have to cover the delegate assembly because they're going to do that virtually. So if anybody wants to volunteer for the virtual, I saw Krista smile like maybe she would be interested in that. The delegate assembly, let me know. Okay. So that's all I had on that, Dr. Bergstrom, unless you had anything on that.
I didn't, just that we all know that one of the wonderful experiences was being able to debrief in person. So I look forward to the time when we can all attend in person again. Similar to just about everything else we're experiencing.
But for the virtual attendance, then let Katie know so that she can register us. Okay.
Please.
There are a number of really, really good sessions. Heather, see ya. Yep.
Yep. Katie, could you possibly share out the information of what Steve is referencing? I couldn't quite see his copy, but I'm sure I have it somewhere, but I would love to review it again.
Yeah, we'll get that. We'll get the school news excerpt out. We'll PDF that out to you guys so that you can see the breakdown of the sessions that they're going to have during the week. So
thank you.
Terrific. I know there are a couple ones that I'd like to see. So, all right, that ends that one. Superintendent's report, Dr. Bergstrom.
Oh, just want to say a few things. And the first is a thank you to Jerry Polly, who has been making some desks for our students through a partnership with Friends of Oregon. So I just think that's a wonderful thing. And there have been so many ways where our community has generously stepped up to ensure they're supporting our, not just the school district, but specifically our families, right? So here's another wonderful example. So thank you for that. And then I just could not end the meeting without saying something about Clue. It was so much fun. I watched it Saturday night, and you know, I was watching it myself in the kitchen, and I was laughing so much that my husband had to come out and see what in the world I was doing, because the kids were fantastic. And he said, how can this be a play? They sound like they're 30 years old. I said, that's because they're acting like sophisticated adults. So you can tell it from their voice when he was even in another room. So they were absolutely terrific. And I also have to say many thanks to the adult leaders in it too, Mr. Doucette and Mr. Mendel, because it was a fun evening and it was wonderful to see what is possible. So many thanks to the Peacock cast and the Mustard cast, because we had two different casts. They each did two performances. Saturday night, I was able to see the Mustard cast, but I wish I had seen the Peacock cast too. And then Homecoming Spirit Days. Thank you, students, for interjecting some sense of normalcy into all of this. I believe today is the Bright Colors Day. Consequently, I am wearing a red top to say Go Panthers. All right, so thank you, students, for doing that. And then just a final wrap up saying thank you very much to our families who are continuing to communicate, to let us know what they're thinking, to share resources with us. It's respected and appreciated.
Thank you. Any questions for Leslie? Okay, that takes us to closing future agenda items. Leslie and I will be working on our agenda for November 23rd. I know we have one item on there, which would be a presentation from Friends of the Orchestra and about the new standards, and we'll have a video from them they've asked to share with us. So we're excited to hear from them as well. We'll have our regular update on the school update and maybe some further information on the survey at that time. But if any board member has any agenda item that they like placed on the agenda, get a hold of Leslie and I, and we'll do that according to board policy. So that takes us to checkout. Krista, Troy, Tim, Anna, got nothing. Heather and Kevin. Okay, I saw the Peacock cast, so they were really, really good too. And I thought it was Colonel Mustard in the library with a rope, but I was wrong. So I watched it yesterday afternoon. So again, thank you them. Katie, you want to hold something up for us? We got a notification from the Wisconsin Association of School Boards that Krista Flanagan is receiving a certification of achievement. So she's moving up, I think, to level 1 or level 2. So we're going to get that to you.
What did I do?
Hey! It's attendance at WASB things and longevity of service. There, I think there are about 4 or 5 ranks, and you're moving up the ladder. So
Okay.
we've got that certificate for you. Congratulations.
Well,
You know,
thank you.
you serve for 22 years, you get to level 5.
Sorry. I'll let
Yeah.
you have that distinction, Steve.
Anyway, but really congratulations for that honor. So we'll get that over to you. With that, we are ready for a motion to adjourn. Everybody wants to
Move to
hang on.
adjourn.
We're done so early, right? Who made the motion? Tim? Katie, did you get the motion in a second? Okay. Call the roll then on that.
Mr. LeBrun,
Yes.
Ms. Bijak,
Yes.
Ms. Garrison,
Yes.
Mr. Maring,
Yes.
Ms. Flanagan,
Yes.
Mr. Pinkratz,
Yes.
Mr. Zach.
Yes, thank you. Thanks, everyone. Be safe.